Hey there, my name is Brooke and I'm with the one and only George Livermore. I have a few questions, and so I've sat him down for a one on one and went through a few of our social media comments. So let's get into the first one. All right, so the first person on social media said, can I have a balloon sinuplasty if I have a deviated septum?
Yes, we frequently do nasal septoplasty in conjunction with balloon sinuplasty. Um, there are times when I don't address the septum if it's not very crooked because I can get around it, but I can always do it at the same time.
Tell me more about healing.
I generally tell my patients in regard to healing that it takes about 2 weeks, 2 to 3 weeks to get over the swelling and that sort of thing. But in terms of activities of daily living, you can generally go back to your work and or school in about 2 to 3 days. There's a little bit of bloody drainage the first day or two. You wear a little gauze underneath your nose. After that tapers off, there's just congestion. And at that point, you usually can go back to work.
How painful will it be during and after the procedure?
The balloon sinuplasty is done under local anesthesia with a little bit of oral sedation. So you're kind of loopy. I tell patients it's kind of like you've had 3 or 4 martinis, so you're not too worried about what I'm doing. And then I numb up the nose with some topical medicine, some packs, and then do some injections, a lot like the dentist. So you can think about it kind of like being at the dentist. There may be times where there might be a spot I didn't numb quite enough, so you might feel something, but generally speaking, we try to make it a painless procedure.
How long is a balloon sinuplasty?
We actually schedule about an hour and a half for a balloon sinuplasty, but it's not because it takes that long to do it. We have you come in, we do it in the office as an outpatient procedure under oral sedation. So we assess how sedated you are because everybody's different and how they react to those kind of medicines. So a lot of the time is doing that. And then we put some little numbing packs in and let you sit and let the numbing take effect. In fact, the procedure probably only takes about 25 minutes, but the time spent is to make sure you're comfortable.
Why would I ever need to be tested for allergies?
Allergy testing is extremely helpful for patients with sinonasal disease because you really can't talk about sinus without talking about allergy. You can't talk about allergy without talking about sinus. So, that being said, allergy is definitely a component to 90% of the patients that come into our office with sinonasal complaints. And if we can identify what you're allergic to, sometimes it's as simple as avoiding that thing. Just like the girl who was allergic to peanuts and kissed her boyfriend who ate a peanut butter sandwich and had an anaphylactic reaction. You've got to avoid the things you're allergic to. And the only way to do that is to identify them. And that's what allergy testing does.
How long till I need another balloon sinuplasty, or is that it?
Ideally, the balloon sinuplasty is the definitive procedure. It should be long lasting and should not need to be revised. Of course, like anything else in medicine, there are times where we have to go back and do a little, what I tell my patients, a little touch up. And that occurs maybe 10% of the time, but 90% of the time, it should be a definitive procedure. Balloon sinuplasty is done for medical reasons. It's to improve your sinonasal health. It's to decrease the amount of sinus infections and that sort of thing that you're having. So in that regard, it is generally covered to whatever extent your insurance policy covers procedures, and everybody's different in terms of what their policy does cover.